Derek Hebner, student physical therapist assistant, and I'll be demonstrating teaching a modified 4-point gait pattern with a single cane. I'll start by cleansing my hands. To begin, I've also ensured that me and my patient have proper footwear and that the area is clear of any tripping hazards or anything unsafe that would get in our way. Okay, so hello, patient. Today we'll be doing a demonstration and instruction on how to teach you how to do a modified 4-point gait pattern with a single cane safely, just to kind of help you do so properly and safely and get you moving around. Before I begin or we go any further, I'd like to explain the process a little bit and make sure I've explained everything properly. Is that okay with you? Okay, great. So to start with, you will be contact guard assist, meaning that I'll be there. I'll be guarding you on your along your left side, where you do have that lower extremity weakness. So we'll be using this gait belt. You are full weight bearing, however, so you will be able to, as you stand and use the single point gait and do the modified 4-point pattern, you can put all of your weight through both of your lower extremities, but this gait pattern will help accommodate for your lower extremity weakness on your left side. Okay, so this gait belt will be it'll be put on you for your safety as well as mine, and it'll just kind of be there to help me have a hold of. That way, in case anything were to happen, I could be right there to assist you. Since you're contact guard assist, you'll be doing all the work, and the gait belt will just kind of be there as kind of a safety measure. Before I put this on you, I just have a couple of questions to ask. Do you have any jewelry or piercings along your abdomen? Any medical devices, implants, tubing, ports, shunts, anything like that? Any open wounds, incisions, bruising? No? Okay. In order to put the gait belt on you, I'll have to get close to you to put this around you. Is it okay if I do that? Okay, do you have any questions before we begin? Okay, so then I would place the gait belt on the patient, and this is there to indicate that they have a lower extremity weakness in their left leg, and the gait belt would now be placed upon them. Okay. All right, so now I would like to explain kind of the process of how this is going to go. So first, and then you've done this before, I'm just going to see this forward just a little bit. In order to begin initially, I will demonstrate first how the sit to stand procedure will go. So since you do have the weakness in your lower extremity on your left leg, the cane will be placed in your right hand, and there are two ways in which you can hold the cane in order to do the sit to stand before we even start ambulating. One is to hold it around the neck of the cane and then do the sit to stand. And the other way would be to hold it with the cane placed forward. Just make sure that whichever way you choose or is more comfortable for you, that your hands are actually on the armrests and not on the cane. So you will scoot forward with the cane in your right hand, and then lean forward, nose over toes, and then you'll press down through the chair, and then use your lower extremities together with your upper extremities to stand up. And then once you're up, you'll place the cane in the tripod position, and that is 2 inches to the side of your foot and 4 to 6 inches forward, so just about right here. And then once you're up like that, like I said, I'll be there on your left side, guarding you on the gait belt, and then I'll just make sure you're not dizzy, lightheaded, nauseous, or anything like that. And then once that's been demonstrated, I'll sit you back down, and then I can push you on the rest of the ambulation process. Before we continue, do you have any questions? Okay. All right, so I will place the cane there for you in your right hand. And now I'll demonstrate how the gait pattern will work once you're up. So once you've stood up and have the cane in the tripod position, we're gonna break the ambulation pattern up to not overwhelm you. So initially you'll just be taking 2 steps forward, 2 steps to the right, 2 steps to the left, and then we'll walk backwards toward the chair, and I will be guarding you on your left side with my hands on the gait belt. So it'll look something like this. Come forward with the gait belt, hands on the armrest, nose over toes, and then stand up using your legs along with your arms pushing into the chair, and then you'll enter the tripod position, and then your modified 4-point gait pattern I'll demonstrate so you understand how it goes. Okay, so you have the left lower extremity weakness. The cane will be in your right hand, and so you will be moving the cane just a small amount forward, right hand, and then your left leg, and then your arm, and then your other leg. And then cane, lower extremity on your left side, arm, right leg. And then that same pattern will follow as we go to the right, and then left, and then back. So cane to the right, and then lower extremity on the left side, then arm, right lower extremity, cane, left lower extremity, left arm, right leg, and then that same pattern once more to go left. So it'll be cane, your left leg, then your left arm, and your right leg, cane, left leg, left arm, right leg. And then that same pattern backwards. So it'll be cane, left leg, arm, right leg, cane, left leg, arm, right leg, and then we're just going to keep going back up until we feel the chair against the back of our legs. So cane, left leg, arm, right leg, cane, left leg, arm, right leg, cane, left leg, arm, right leg, and then we feel the chair there. So with the chair felt there, I'll be along your left side again as a reminder to protect you. And you'll be turning around. You'll notice where the armrests are, and then much like how we stood up, you'll bend at the hips and the knees with your arms, then touching the chair forward and then back, all in one nice smooth motion. And I'll be right on your left side to guard and protect you as you come down. Okay, so before we go ahead and try that, did you have any questions or anything like that? Okay, all right. Is it okay if we begin? Okay, and then this would, at this point in the process, this would be where I make sure the patient understood their weight-bearing status, their full weight bearing. They can apply both all of their body weight through both lower extremities, and their contact guard assist, so the gait belt will be on them. I will be guarding them along their left side of the posterior lateral alignment, with one hand on the gait belt and then the other on their anterior shoulder. They will go nose over toes, lean forward, press through the armrest with the cane in the right hand, and then stand up. At which point I'll make sure that they're not dizzy, lightheaded, or nauseous. And then once they're shown an ability to be able to do that without being lightheaded or nauseous, sit them back down and then have them perform the gait pattern in just the portion that I demonstrated for them there, and then I'll be guarding them along their posterior lateral left side with the hands on the gait belt, letting them do all the work, and coaching them in that pattern of affected side or right arm where the crutch or cane would be, cane in this instance, and then the affected leg, and then the opposite arm, and then the affected side leg. As they would go forward, left, right, and then back up until the chair met the back of their thighs, reach back, grab the armrest, and then lower themselves down. And then upon successful completion of that, I would then demonstrate the rest of the process, which will involve turning right, left, and then doing the banana back to the chair. Okay, and so with that done, now I'd like to demonstrate how we turn. So it will be initially easier and more safe for you to turn towards your strong side, which in your case will be your right side, because you have the left lower extremity weakness. So we're going to follow that same basic modified 4-point gait pattern that we discussed earlier, doing small movements. So you're going to want to go crutch on the affected side, and then affected leg, arm, and then foot. Crutch, affected leg, arm, 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 foot. And then to turn, same way, turning left. This will be the less desirable as it is towards your weak side, but it'll be helpful for you to know how to do this as well, just to give you greater movement and function for the future, and give you better access to all of the functional activities that you'd like to be up and doing. So turning to the left then, so cane, affected leg, arm, right leg, 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 until we're back facing the chair, and then we'll do the banana. So cane, affected leg, arm, right leg, cane, affected leg, arm, right leg, cane, affected leg, arm, right leg. Okay, and then I'll demonstrate now how to return to the chair. So you're going to want to go partially wide and then approach the chair on your strong side, which in this case for the patient would be their right side. So they'll be swinging a little bit out to the right so that the chair will be all along their right or strong side, so that they can get sat down as safely as possible. So, following that same gait pattern, cane, affected leg on right leg. I'm just going to be following that same basic pattern. Just small movements. Okay, and then we've approached the chair on the strong side, and then the chair is right behind us, so we'll then back up, following that same pattern with cane, affected leg on right leg, until the chair is made contact with our feet and we can feel it, and then sit down much the same way we did before, turning around, noticing the armrests, and then feeling them, and then sitting down, bending forward at the hip, as well as the knees, to come back in the chair, and I'll be guarding the patient on the left side as they do that whole process. And so now that I've demonstrated the process, I'm going to ask the patient if they have any questions, and then if they don't, then we could go ahead and get started. They have their cane, I've demonstrated, and then we go ahead and do the sit to stand. I'd have them lean forward, hands on the armrest, nose over toes, and then the count of 3, they'd come up, they'd be doing all the work, and I'd be guarding them on the gait belt there and there, and then they would do the rest of the ambulation pattern that I've covered with them, with the turn to the right, turn to the left, and then approach the chair on the strong side, and then back to sitting down. Okay, and then I'd do that as well with the patient. As they stood up, I'd make sure that they weren't dizzy or lightheaded, nauseous or anything like that. Make sure they didn't have any questions. And then as they performed the gait process, I would be coaching them on, the specifics of the modified 4-point with the pattern of the crutch, lower or affected side arm, and then right side, and then making sure that they were doing small movements and not going too fast or taking too big of turns or anything like that, or going too far with the cane, which would reduce their stability. And then once we've successfully completed that, I'd sit them back down. I would wash my hands, and I'd be ready for my next patient. Okay.